program do not necessarily represent those of Revive FM or its management.
Hello and welcome to the VacciNation Roadshow. Thank you very much for tuning in. And just before we get started, the return of all children and young people to school has been a huge success, with teachers and pupils delighted to be back. Thanks to NHS Test and Trace and all education staff. Secondary and college pupils are now taking regular rapid COVID-19 tests at home, and we encourage them to keep on testing over the Easter break. Also, if you're a parent or in a support bubble of a child at nursery, school, or college, you can have rapid tests twice a week if you don't have COVID-19 symptoms. Millions of people are already using regular rapid testing. By getting into a family routine of testing twice a week, you'll be helping to keep those close to you safer. Tests are free, easy to find, and easy to use. To find out more, visit nhs.uk/coronavirus. Thank you so much for tuning in. You're listening to Revive FM 94.0. This is your host, Awais Anwar, and today we are doing the VacciNation Roadshow, clearing misconceptions about the vaccine. To give us a call, you can call us on 0333 444 0940. That's 0333 444 0940. You can send us a WhatsApp, and you can you can listen on our website, Facebook, YouTube, and on TuneIn. Today with me, I have my guest today I'm honored to have Dr. Zahid. Dr. Zahid is a consultant for occupational medicine. Hello, Dr. Zahid. How are you?
I'm fine, thank you, Awais. How are you?
I'm good, thank you very much. Thank you for coming. We're very honored to be interviewing you, and it's an honor to actually be in your presence. Thank you for actually taking your time out for such an important topic that people are clearing misconceptions in today's day and age, especially through the pandemic.
It's a pleasure to be on your show.
Just to start off, I just want to ask you what a vaccine is and how it works.
Right, a vaccine is a way of protecting people against harmful diseases, especially those that are spread by germs like viruses or bacteria. So it's not a treatment as such, but it's a preventative measure. And what it does, it uses your body's own natural defenses to build resistance to infections, specific infections, and a vaccine makes your immune system stronger. So if you think about contracting an infection, like whether it's measles or chickenpox or a flu or a cold, so what happens is your body mounts an immune response to it. So once you've had that disease and hopefully recovered, you're protected against having it the next time, because the immune system has been fired up, and that's how our immune system has been programmed. So what a vaccine does, it trains your immune system without being exposed to the disease. So vaccines, they contain only sort of weakened forms of the disease or the virus or the germs, or the killed versions, or just a copy of the genetic material. So they don't cause the disease or put you at risk of its complications. So they're given to you usually by an injection, although some vaccines are given orally or by the mouth, or some are even sprayed through the nose. But after you've had the vaccine, the body mounts an immune response. So when you are exposed to the germs again that you're vaccinated against, you're protected against the effects of those germs, whether they're viruses or bacteria.
Why do we need a vaccination program against COVID-19, especially now that the numbers are declining and a lot of people have had the virus and they're recovered? So they'll have the antibodies, I guess.
Well, it's a good question. I mean, you can see that we are seeing quite a rapid decline in the number of people being affected, and that includes hospital admissions as well as the number of people dying. But and there's been quite a steep decline, actually. But I would say, and most scientists agree, that the vaccination program has probably been has made quite a large contribution to that. Obviously, the lockdown has as well, but I mean, we can tell that it's largely, or there's a large element of the vaccine being involved, because the over 85s, who were the first group to be vaccinated, their vaccination started in December. There was a sharp decline in their rates of infection. So it is essential, and I think the fact is that this coronavirus isn't going to go away. It'll be coming back. There may be different forms of it or different variants, but it's not going to go away, and we can't really have perpetual lockdowns. They're devastating in terms of the economic impact, the mental health of people. They're devastating in terms of the social impact, the education of our children. Our children were away from schools and colleges for the most part of a year. So they're having a major impact on people's mental health, and also hospitals becoming inundated with patients, and therefore waiting lists or waiting times going up for other routine operations and other problems. So these things, if unless we have a vaccine, we're going to be in this potentially perpetual situation. So that's why it's really important, and vaccination really is our only way and most effective way out of this problem.
How safe is the vaccine?
Well, vaccines in general are extremely safe, and severe side effects or reactions are relatively rare. They do have milder side effects, and people who've had the vaccine will testify to that. They do get, many people do get sort of milder reactions. But the thing is about this COVID vaccine, I think people there's been some controversy about its safety, particularly because its development was very, very rapid. So obviously people are quite wary about its safety. But I mean, to reassure people, it has been put through very vigorous testing, safety testing. So when vaccines are brought out, they go through phases of testing. And in this case, in the case of the COVID vaccine, many of the developers, they tested it rather than sequentially, so one test and then another test of efficacy. They did all those steps concurrently, so that's why it was quick. But they did actually test it in the normal way, and on quite large groups of volunteers, and then all the data and all the safety data was checked by regulatory organizations. Like, for example, in the UK, it's the MHRA, which stands for the Medicines and Healthcare Products Regulatory Agencies. It actually governs the safety, ensures the safety of all the medicines and all the treatments that are in use. And so they checked it, and they passed it as being safe. And that's the same. That's the case for regulatory authorities around the world. So whether that's in the United States, you've got the FDA, you've got the European Medicines Agency in Europe. They've checked it, and they have validated its safety. And the other thing to note is that vaccines, the safety is being monitored all the time as we go along. So and that's why we had this controversy about the blood clots, because the effects or potential effects of the vaccine were being monitored continuously, and that's another safety measure. I mean, ultimately, these blood clots were found not to be associated or not to be caused by the virus, but it just goes to show that the vaccine is being constantly monitored, or its safety or its effects in people.
What are the side effects of the virus? Not the virus, sorry, the vaccine. Obviously, the vaccine has been monitored, like you said, and it's been tested out on a large number of volunteers. So, what are the sort of minor, major side effects?
Well, the most common ones are soreness in the arm where it's given. So some people develop, or many people I mean, you could even say most people develop some element of soreness in the arm. But many people, they develop flu-like symptoms. They feel tired or maybe a bit shivery, or they get headaches. Usually those effects don't last for very long, 2 or 3 days, and people get back to normal. So those are the most common side effects. In fact, those side effects are a sign that the immune system is being fired up. So it's a sign that the vaccine is working. So people shouldn't be worried about those side effects. Severe side effects are much rare. Some people are allergic to the ingredients and they might develop a very severe allergic response, but fortunately that's very, very rare. So those are the main side effects that people should be aware of.
Why do you think some people are against the virus? People, conspiracy theorists and anti-vaxxers. What are the main reasons for that, and how can you rebuttal that?
Probably there's various reasons. I think, as I mentioned before, the speed of the development of the vaccine, perhaps people were made aware that vaccines normally take years to develop, and here we are. There were a number of vaccines that were developed in a fraction of the time, and I think people thought, well, hang on, there must be shortcuts here. So that was probably one factor. There's also quite a large, or maybe it's growing, I don't know, it's a large, what we call an anti-vaxxer movement. And that was apparent with quite a few other vaccines. So things like measles vaccine, because there was this, a few years back, there was this idea that measles and mumps and rubella vaccine, or the MMR vaccine that's given during childhood, there was this idea, mistaken idea, that it causes autism. And so people became very wary of it, and so people stopped. Many parents, they stopped giving their children the vaccine, the MMR vaccine, and unfortunately, as a result, lots of children got measles and died from it, and also developed. It's quite a nasty disease, actually, in some children. So they died, or they had quite life-changing effects from it. So there was this movement, and it has continued. You know, people or groups of people who are skeptical about vaccines in general. But and I think whatever the reasons, the other thing is that there is a lot of social media coverage, and these kind of doubts that people have, they've just been accentuated by the social media coverage. There's a lot of propaganda and a lot of misinformation and downright untruths, which are quite dangerous, really, if they're putting people off vaccination. And I think that's a shame. And I think that the trouble is that many people don't have, or perhaps not trained to think in a scientific way. They don't really know how to evaluate evidence. They have, quite a few people have different ideas of coincidence and cause and effect, and so on. And so, if so they might, when there is a coincidence, they attribute it to a certain thing, and or conspiracy. So there's all these conspiracy theories as well. So there's many factors accentuated by the internet and social media.
How would you rebuttal all of this? Like, what's the best way to sort of dispute all these theories?
Well, I think it's actually educating people that the vast majority, or not even the vast majority. I mean, the almost all the scientists, experts, whether they're immunologists, whether they're virologists, consultants, or specialists in infectious diseases, they've all, almost without exception, they have they don't complain about the vaccine in terms of, or they have validated its safety. the safety of these vaccines and the efficacy has been tested through trials, and these are what we called randomized double-blind trials. So, then that's the gold standard for testing medication. So you get one group who is given the vaccine and another group, very similar group, who is not given the vaccine during its testing phase, but they're given perhaps a kind of an injection which contains some kind of saline perhaps, and there's a comparison made between those two groups, and these studies have shown that those who received the vaccine, they had very, very high rates of resistance against severe COVID infections, whereas those who didn't get the vaccine, they showed very high rates of COVID infection, and some of them very severe. And not only that, the ones who received the placebo or the kind of the non-vaccine, they actually showed quite high rates of side effects, and not dissimilar to the ones who received the vaccine. So, and that's usually because of a strong placebo effect. If that's well known in science. So these are the trials that were done. They're very vigorous. They've been scientifically validated, and what you will see essentially when you look into these conspiracies, you look at a YouTube video. It may even be a doctor or maybe somebody who's medically qualified. Sometimes you don't even know if they're medically qualified, but if they are, they're certainly not an expert in that field. And it's just like me starting to go out on the internet saying, well, I've looked at this. I'm not an expert in infectious disease. I'm not an expert in immunology. I'm a doctor of medicine, but I don't feel qualified. I may have done my research. It's like me setting up a YouTube channel, and start spouting nonsense against the vaccine. And probably there are many people in that position, and unfortunately, people who aren't necessarily scientifically trained, which probably is most people, they can be quite taken in by that sort of speech. So that's what I would say. I mean, the rebuttal is in the scientific process, and the fact that all regulatory bodies have actually accepted the efficacy of the virus as well as its safety. So there's really no doubt about it.
Thank you so much, Dr. Zahid. We're just going to go on a very short break, and we'd love to have you back after the break. Thank you for staying tuned, and please stay tuned. You're listening to the VacciNation Roadshow, and we'll be back shortly after the break.
If you want to advertise your business on Revive FM, then visit www.revivefm.co.uk or contact our sales team now on 07944 565616. That's 07944 565616. Advertise with Revive FM.
Super Best Meze Grill, the Turkish restaurant where all our food is prepared to perfection. Our mixed grill family platters include lamb shish, chicken shish, Adana kebab, lamb ribs, chicken doner, chicken wings and lamb chops, and all are served with rice, salad, along with a selection of our cold mezes. To see our full menu, go to superbestmezegrill.co.uk. For the perfect dining setting, visit us now at 21 to 23 Broadway, Stratford, E15 4B, or call 0208 555 3335. Super Best Meze Grill.
Looking to get your finances in order? MR Accountants has you covered. We provide a full range of accountancy and taxation services, including annual and management accounts, self-assessment tax returns, VAT, bookkeeping, and payroll services. We ensure you're kept up to date with the latest legislation, and our client-focused approach helps us plan your business finances from savings to investments. We are MR Accountants. Visit our website at mraccountants.com or call us on 0203 432 9138.
ये आयशा है, ये बहुत छोटी सी थी जब इसके वालिद का एक हादसे में इंतकाल हो गया। वो अपनी माँ और छोटे बहन भाइयों के साथ रहती है। आयशा जैसी लाखों बच्चियां जिंदगी की बुनियादी सहूलतों से बिल्कुल महरूम है। यही वजह है कि वो स्कूल भी नहीं जा सकती। मिनहाज वेलफेयर फाउंडेशन ने आपके एहतियात और अपनी खिदमत दुनिया भर के यतीम और बेसहारा बच्चों के लिए वक्फ कर दी है। एक यतीम और बेसहारा बच्चे का सहारा बनिए। आज ही अतिया कीजिए।
अभी कॉल मिलाएं 0300 3030 या हमारी वेबसाइट विजिट करें www.minhajwelfare.org.
With over 40 years experience in the industry, Plachette Carpets is the place to go for all your carpets, laminates, linos and wood flooring. We have an established network of suppliers, which means we can offer some of the best prices in town. We offer free estimates, free measurements and now even free fitting. Call us now on 0208 472 8568 or visit us at 157 Plachette Road, Upton Park, London, E13 0QZ.
A warm welcome and a good day to all our listeners. Schools and colleges are now open to all pupils and they remain the best place for children and young people to be. Richard G, a very warm welcome to you. Now, it's a fact that around 1 in 3 people who have COVID-19 have no symptoms and could be spreading it to friends and family without knowing. So it's vital that we maintain a system of testing to help protect our loved ones. Would you agree?
Absolutely, Peter. The more of us that are testing twice weekly, the more we can protect each other and keep everyone safer. Regular rapid testing is free, it's easy to get and easy to do. I'd like to add that parents can feel confident that all schools have protective measures in place to support schools remaining open safely.
As we know, schools can remain the best place for children and young people to be. Let's keep each other safe and remember, testing is free and easy to get. To find out more, please visit nhs.uk/coronavirus.
Here at Duncan Lewis Solicitors, we specialise in immigration and family law. We have a proven track record of successful applicants who we've helped secure permanent residency for. From spouse visas to seeking asylum, our expert advisors will assist you throughout the whole application process. We offer a free no obligation consultation, so call us now on 0208 432 3350. That's 0208 432 3350 or visit us at 298 Romford Road, London, E7 9HD.
Revive FM
94.0 on the radio,
on your mobile
and online.
Hello and welcome back to your show, the VacciNation Roadshow. It's an honor to have our guest, Dr. Zahid Iqbal. And just before bringing him back home, just want everyone to know, we all know it's been a very tough year and it's important that we take care of our physical health. Now is the perfect time to start by making small, simple, sustainable changes to what and how much we're eating and drinking, like adding vegetables and proteins to our meal. And keeping active during the lockdown. If you want to lose weight, get active, or both, the NHS has lots of tips and ideas to help you live a healthier life. Just visit nhs.uk/better health. I would like to welcome Dr. Zahid again. Dr. Zahid, thank you very much for coming on. Hello, Dr. Zahid?
Can you hear me?
Yes, I can hear you. Thank you. So, Dr. Zahid, before the break, we were just talking about, we had some questions about the vaccination and you were clearing up a lot of the conspiracies and a lot of the misconceptions. So there are some more questions. So if I ask you the first one, does the vaccine cause infertility? And if anyone is trying to have a child, should they be avoiding taking the vaccine?
No, there's no evidence that it causes infertility. There was some kind of misinformation about that, I know. But all these experts are saying that it has absolutely no effect on infertility. If people are trying for a baby, then, or if they are undergoing, or if they're concerned about infertility, then they shouldn't worry.
And there's different brands of vaccine, for example, the Pfizer vaccine and the AstraZeneca one, Oxford. Which vaccine is better and which one would you recommend?
Yeah, you're right. I mean, there are many vaccines coming out now. The Pfizer one was obviously the first one to to come out, and then there's AstraZeneca, then there's one Moderna, which is coming out soon, or maybe has come out. There's one by Johnson & Johnson. There's even a vaccine called Sputnik, which is being produced by the Russians, or developed by the Russians, and I believe there's one that's been developed in India and China. So I can't really say much about those ones. I haven't really looked into the ones from India or Russia or from Russia, but certainly the common ones, the ones you will get here, which are the Pfizer and the AstraZeneca, they're more or less the same in terms of efficacy and side effect profile. They have similar methods of action, although not the same. But I would say that there probably isn't much difference in terms of their relative or respective efficacy and their side effect profile. They were tested in different ways, so you will get differences in terms of the numbers and the percentages of efficacy and side effects, because they were tested in different ways. Their mechanisms of action are, as I said, similar but not the same. So there may be some differences there. But in the real world, things that are done in trials or things that are in test tubes, they don't necessarily extrapolate well to the real world, because everyone's an individual. We have our own genetic differences in how we react to certain things. So even though there are different vaccines with slightly different effects, slightly different mechanisms of action, in the real world, they balance each other out, essentially. So I would say that if whatever vaccine you're getting, you're going to get one that is effective, and you're also going to get one which is safe, whether that be Pfizer or AstraZeneca, or the so-called Oxford vaccine. So I would ask people not to be concerned about which one they're getting. I think I think they will probably get the same one, so they'll get the first dose and they'll get a second dose, and I think it would be normal practice for them to get the same vaccine the next time round. If they do get another vaccine, then I'm sure that they will make sure that that's valid and that's based on the evidence. They're not just going to start giving the second dose as a different vaccine unless there is evidence or the data shows that a different vaccine is going to be as effective as having and safe as having the same one the first time round. So I wouldn't worry if that happens to be the case.
With the vaccine, with AstraZeneca, there was some rumors that it's causing blood clots, something that you mentioned earlier as well. So do you mind just giving some clarity on that as well? Just obviously the UK didn't stop using it. Obviously, like you said, it's been safe, it's been approved. So just so the viewers can understand, and so that there's no
I mean, you're right. I mean, there was some concerns, especially in Europe, and some countries in Europe, like Germany and some others, they paused the administration of the AstraZeneca vaccine precisely because there was this. There were cases reported of people developing blood clots or dangerous blood clots after getting the vaccine. Now, the various authorities, they looked into that. The European Medicines Agency, for example, they looked into the data, and they absolutely refuted a causal link between the vaccine and these blood clots. If you think about it, actually, the number of blood clots or the number of cases we're talking about is less than or around 50. And if you compare that to the millions of doses of the vaccines that were given, you've got an extremely low rate of these blood clots happening. So even if they were linked, let's say for argument, there was a link between the vaccine and developing these blood clots, they're so exceedingly rare that people should not be concerned. Let's just, as I said, let's just say for sake of argument, there was a link, because you're much more likely to catch COVID and die than, without the vaccine, or have a serious effect from the COVID infection. Some even young people have been known to die. But then you've also got the problem of long COVID, or so-called long COVID. So there are young people who get COVID infection, and although they may get over the acute phase, they start developing a more prolonged illness. When they're calling it post-COVID syndrome now, and that's quite devastating in terms of impact on their lives and their livelihood. So let's look at it. Would you rather have COVID and the higher risk of you becoming unwell, and the much higher risk of you either dying or becoming unwell in the long term, than having the vaccine and the much lower risk, exceedingly rare risk of having blood clots? That's if we assume that those blood clots were associated with the virus. But I think the evidence, however, is pointing to the fact that those blood clots were not caused by the virus. You see, blood clots happen anyway. I mean, I don't know exactly how many, but you probably get a few, maybe 1,000 or 2,000 per week anyway, developing in people generally in the population. And in fact, the number of blood clots developing in those people who had the vaccine was actually lower than you would expect in the general population. I would say that the evidence therefore suggests that there wasn't a causal link, and that is quite a strong evidence. That there was some concern about a very rare type of blood clot which happens in the brain, and again, I think there are literally a handful of those cases, and there may be more of a link between the vaccine and that type of rare blood clot in the brain. Again, but there was just a handful, so they are monitoring that situation. They haven't ruled out a link between that type of blood clot and the vaccine. But as I said, you literally had a handful. You can count the number of cases of those in single digits, compared to the millions of doses of the vaccine that have been given. So your chances of developing something like that is like 1 in a million, 1 in 2 million, something along those lines. Whereas the chances of you developing dying or having some serious effects from coronavirus, being hospitalized, is much higher. So again, even if we, for sake of argument, there is a link, you're far better off having the vaccine, far safer than actually not having it.
One question similar to the infertility question is that can pregnant or breastfeeding, someone who's breastfeeding, get the vaccine?
Yeah, my understanding is somebody who is breastfeeding, they can have the vaccine. It's not considered unsafe. With regard to pregnancy, that there's a slightly it's a little bit more complicated. The reason being is that the safety, when these trials were being carried out, they didn't include pregnant women, just out of as a precaution. So I think the advice is that they're not being pregnant women are not being told not to have the vaccination, but to think about it and speak to their GP or speak to their consultants or their healthcare providers about being vaccinated. And as I said, it's not because necessarily they are unsafe in pregnancy. It's just they haven't been tested as much as they have in non-pregnant people. And I would say that there is, because of the high risk particularly in some groups of pregnant women, Black and ethnic minority women who are pregnant, there is evidence that they have a higher risk of death or serious effects from contracting COVID, it may be that they perhaps should think about having the vaccine, because the risk versus benefit ratio is probably much more favorable in terms of in respect of having the vaccine than not having it. So it's a little bit more complicated for pregnancy. I would say that there is no, to sum up, there isn't any contraindication. In other words, there's no objection absolutely to having the vaccine, but people need to think about it a little bit more carefully if they are pregnant.
What about with young children?
Well, young children, at the moment, they're not being vaccinated. But I think when the time comes I think they are thinking about vaccinating young people. But again, there's no evidence that they're unsafe in young people or your children. So I wouldn't be too concerned if the advice is eventually that young people or your children should be vaccinated. Then it would be made on very, very good grounds, and only based on the fact that the scientists have looked into it and they've seen benefit in children being vaccinated, and that the side effects aren't going to be prominent or common in young children. So at the moment, I'm not sure if they are going to be rolling them out to young children. Generally speaking, COVID is not is far less dangerous in children, but I think they may consider it because vaccinating young children, because they are trying to get what we call herd immunity. I know it was a dirty word a few months back, but that's the whole point of getting a vaccine or having a vaccination program, because you want to get to a stage where a certain proportion of the population has been vaccinated. So it might be 80-90% perhaps. So that's basically to induce herd immunity, and that causes the virus to stop spreading. Okay, even though the entire population hasn't been vaccinated, the opportunity for the virus to jump from one person to another is reduced, far more when lots of people have been vaccinated. So it just kind of disappears. So they want to induce herd immunity, and that's probably the best way. That is the best way to induce herd immunity, rather than let the infection run rife and then cause herd immunity and cause many people to die, many more people to die. It's better to have it in a controlled way through a vaccine program. And vaccines are generally safe in children. We vaccinate our children all the time in this country and around the world, in terms of measles, mumps and rubella and tetanus and polio, and these types of vaccines are extremely effective at preventing those very, very nasty diseases. And the same would be the case for the coronavirus vaccine if they decide to vaccinate young people or children.
Thank you so much, Dr. Zahid. We're just going to go on a very short break and we'll be back with you. Thank you so much for clarifying a lot of the misconceptions. And please stay tuned. We'll be back shortly after the break.
Assalamu alaikum, listeners. Welcome. We know that the last year has been tough on all of us, but there has never been a better time to have a go at some new, healthier habits. Healthy changes start with little changes and will help you feel better. So we'll hear now from a local health professional about how best to achieve this from home. We've got our dear brother Suleiman Rafiq, a senior public health manager here in Luton. Simple question to start off with. Why is it important that we are not overweight?
I think often people think about it in terms of having a single reason, but there are so many benefits to being a healthy weight.
In regards to being overweight, what kind of health issues can being overweight cause?
Yeah, I think particularly carrying extra weight is quite dangerous in terms of having that extra fat within your body, particularly around your organs. And that's why it has such an impact on your cardiovascular health and your physical health as well.
Is there a simple way of losing weight?
This is about making small changes. So, some of those changes could be around drinking more water, trying to make sure that throughout the day we're drinking enough water. So small and sustainable changes are really the key to what we're talking about.
When we're saying trying to lose weight, is it important to be physically active at the same time?
Yeah, so being physically active has lots of benefits. So I think being physically active is a really important element. And, let's be clear on that, is that's even just going for a walk, maybe doing some DIY, but, doing something that requires physical exertion is really, really important. But when it comes to weight, obviously physical activity is important, but also it's about your food that you're taking in as well. The diet side of things is very important.
So from what I'm hearing, it's basically it's a mix of both.
Absolutely. As I say, it's really about making those small and sustainable changes. So, when it comes to eating well, maybe having 2 or more vegetables with your main meal. As I say, in terms of diet, again, drinking water throughout the day. And then, as you said, physical activity, really important. So, get into the habit of going for a walk every morning or whatever works with your own routine, but try and find the time to have that sustained everyday activity.
Is there any apps out there that our listeners can actually use to aid their journey towards a better health?
Yeah, absolutely. So the NHS have produced a wide range of fantastic apps and they're available on the normal app stores. The first one was in regards to the NHS Couch to 5K app. It takes you from being on the couch to being able to go to 5K. The other app that I would want to highlight, again, NHS app that is available for free, is called Easy Meals, available to all of us to try and improve that diet side of things as well.
Thank you so much for all your amazing advice. Listeners, whether you want to lose weight or get active, the NHS has lots of free top tips and ideas to help you live a healthier life. For more information, search nhs.uk/better health.
ये आयशा है। ये बहुत छोटी सी थी जब इसके वालिद का एक हादसे में इंतकाल हो गया। वो अपनी माँ और छोटे बहन भाइयों के साथ रहती है। आयशा जैसी लाखों बच्चियां जिंदगी की बुनियादी सहूलतों से बिल्कुल महरूम हैं। यही वजह है कि वो स्कूल भी नहीं जा सकती। मिनहाज वेलफेयर फाउंडेशन ने आपके एहतियात और अपनी खिदमत दुनिया भर के यतीम और बेसहारा बच्चों के लिए वक्फ कर दी है। एक यतीम और बेसहारा बच्चे का सहारा बनिए। आज ही अतिया कीजिए।
अभी कॉल मिलाएं 0300 3030 या हमारी वेबसाइट विजिट करें www.minhajwelfare.org.
Every window opened to let in fresh air. Every room well ventilated. When a carer or electrician calls. Everyone who opens a window when someone else is in their home is helping stop the spread of COVID-19 because it helps blow away coronavirus particles that could be in the air. Everything we're doing is making a difference. Let's keep going. Stay home. Protect the NHS. Save lives.
Kebabish Original, one of the biggest names in the restaurant trade. Visit your local KO to experience the thrill of the grill and the most authentic Pakistani cuisine. From our kebabs to our curries and from our mixed platters to our peri-peri, our chefs prepare your food in front of you while you wait. KO is now offering franchise opportunities. To take advantage of our proven and successful business model, contact us on 0208 446 7779 or visit kebabishoriginal.co.uk.
Super Best Meze Grill, the Turkish restaurant where all our food is prepared to perfection. Our mixed grill family platters include lamb shish, chicken shish, Adana kebab, lamb ribs, chicken doner, chicken wings and lamb chops, and all are served with rice, salad, along with a selection of our cold mezes. To see our full menu, go to superbestmezegrill.co.uk. For the perfect dining setting, visit us now at 21 to 23 Broadway, Stratford, E15 4B, or call 0208 555 335. Super Best Meze Grill.
हर कदम पर एहतियात से सड़क पार करना, फुटपाथ पर फैलाए बगैर पब्लिक ट्रांसपोर्ट पर खाली जगह का ख्याल रखना, शॉपिंग ट्रॉलीज के दरमियान फासिला रखना। हर वो शख्स जो बाहर जाने पर मुनासिब दूरी बनाए रखता है, वो कोविड-19 को फैलने से रोकने में मदद दे रहा है, क्योंकि हर 3 में से एक शख्स जिसकी अलामात भी जाहिर नहीं होती, वो अनजाने में इसे फैला सकता है। इन चीजों से फर्क पड़ता है। आइए ऐसा करते रहें। घर रहिए, NHS को तहफ्फुज़ दीजिए, जिंदगियां बचाइए।
Many men suffering abuse at the hands of their partners think they're to blame, that they're weak. That is not the case. We are here for you. We are the Mankind Initiative, and we have been helping men escape from domestic abuse since 2001. Call us on our helpline 01 823 334244. That is 01 823 334244. The lines are open from 10 till 4, Monday to Friday. Remember, you're not alone.
Revive FM
94.0. On the radio.
on your mobile.
And online.
Hello and welcome back to your show, the VacciNation radio show. Thank you very much for tuning in, and this is a very important show, clearing misconceptions and conspiracy theories with medical practice, someone who practices medicine, Dr. Zahid Iqbal. Once again, it's an honor to host you today, and thank you for coming on.
Hello, yes, thank you.
So before the break, we were answering questions, and there's a couple more. So just so we can go straight into it, how can we stay safe from COVID-19?
Well, the government have issued a lot of guidance on this, but it is essentially following that government guidance, which includes social distancing and following the current government guidance on that, whatever that is at the moment. Obviously, most people know the rules, not so it is keeping that social distancing going, and also it's very important to maintain hygiene measures, washing your hands or using alcohol gels to make sure that you're not harboring the virus, so that if you touch your face or your mouth, which you should avoid doing, that you're not passing any viral particles into your mucous membrane, into your nose or your mouth or your eyes if you rubbed your eyes. So meticulous, or you're not spreading it around to other places or surfaces around you. So meticulous hygiene is also very, very important, in addition to the social distancing. Wearing face masks, that has been a controversial issue, but I think now most people have accepted that it is a good way or effective way of ensuring that if you have the virus and you've got an infection that you're not aware of, that the mask actually protects you from spreading it to other people to some degree, or to a reasonable degree, and also stops your virus from actually infecting or contaminating surfaces that other people then might touch and then get the virus from. So those are the main measures which will protect you. Those people who are shielding should remain shielding until the time to unshield comes along, which is I think probably April, I think, for the people who are shielding. So those are the people who are much more vulnerable, or regarded as clinically extremely vulnerable because of their age or because of their medical conditions. So they should remain shielding. And of course, I think as we've discussed, to stay absolutely safe is to get vaccinated. So that will vastly increase your chances of becoming resistant to severe COVID infection and indeed dying from it. The efficacy of these vaccines is actually much better than we expected, and so that's probably going to be the best way moving forward of staying safe from COVID vaccine. It's also the socially conscientious decision as well, because you're benefiting not only yourself, but you're benefiting wider society through not spreading the virus, and and it's actually, I think it's the kindest and socially aware thing to do. So get vaccinated.
What's going on in hospitals right now? Are there many COVID patients, and how are they getting treated? Is it treatment effective as well?
Well, we saw that particularly after Christmas, there was the number of cases skyrocketed because of, usually in winter viral infections do increase, but I think perhaps the relaxation of the lockdown during the Christmas period didn't help, and the relaxation of all the restrictions from the summer. So there was a skyrocketing of infections in the community, and what happened was that led to a steep increase in the number of hospital admissions, and the fear was that and I think that the NHS was getting close to becoming overwhelmed with seriously ill people with COVID infection, and the capacity was being overloaded or potentially being overloaded to deal, particularly in the ICU beds, number of ICU beds, to deal with those with really, really severe forms of the infection. So it was a terrible time over the winter for the NHS staff members, and I think we should really applaud the way that they worked through this tirelessly and very courageously to deal with these the large increase. So there was a massive increase, and I know, speaking to colleagues, they were getting very tired and stressed because of the situation. And I think that's what people who are against a lockdown or who are against masks didn't really appreciate, that but the reason why we had the lockdown was to save the NHS, or it was to make sure that it didn't get so overwhelmed that doctors or nurses were having to make decisions as to which patients to save and which not to save because of a lack of ICU beds. I mean, fortunately, it didn't quite get to that stage, but it could have done if it wasn't for the lockdown. Fortunately, what we're seeing now is a steep decrease in the number of hospital admissions, and also the number of people dying from it as well. I mean, it still is an issue and a potential issue, but the urgency of the matter is perhaps not so acute, and so if you go to hospitals now, they're perhaps not as crowded with COVID patients as they were over the summer. In terms of treatments, there have been quite effective treatments. Particularly for the severe forms of infection, people have been given steroid treatment, which is known to be effective in severe COVID infection. And what steroid treatments do is dampen down the immune response, which seems to be responsible in many of the severe cases for causing organ damage. So that's what basically the body becomes the immune reaction to the COVID vaccine becomes so exaggerated that you need to dampen it down. Otherwise, the immune reaction causes organ damage. So steroids have been quite effective, as well as a particular type of antiviral drug, not hydroxychloroquine as President Trump was trumpeting. So that was shown to be ineffective. So yeah, there have been reasonably effective treatments, particularly for the more severe forms, which did actually reduce the death rate quite significantly. But again, these aren't foolproof remedies. So some people, even after having steroids, can die, and as I said, many people who get COVID develop long COVID syndrome or post COVID syndrome, which is quite a severe condition and prolonged condition in many people.
Why are the ethnic communities slow on the uptake of the vaccine?
More or less the same reasons as the wider population who are showing so-called vaccine hesitancy. So there's a lot of stuff in social media, a lot of misinformation. a lot of untruths, a lot of fake news about the vaccine, about COVID and so on. And so it's not surprising that the Black and Asian and ethnic minority groups are also having, or certain of them are also showing vaccine hesitancy. There are also particular issues with the BAME communities. There is certainly, I think, some mistrust, more mistrust because of the vaccine, because when it was being tested by the different manufacturers, perhaps the people the volunteers, they weren't many Black or ethnic minority people being represented in those groups that were being tested. So perhaps they felt that because of that, it meant that the vaccine wasn't safe. There's also a history of Black people being used as guinea pigs. I mean, thankfully that's historical, and I think perhaps there was some element of that kind of creeping into this mistrust. And I think generally speaking, because BAME communities, they are generally speaking from lower socioeconomic backgrounds, they feel they have a less of a stake in the health system perhaps, and that probably played a part. I also think that actually, and this might be a bit controversial, but many BAME communities, they have strong religious affiliations, and I feel that one factor has been ignorant preachers who take advantage of the fear that the virus is causing, and take advantage of that anxiety in their congregations, and then they instill even more fear into the vaccines, and that's really basically a means of controlling their congregations to exert more control. And I think that's probably been a factor. So ignorant preachers who perhaps should know better. So that probably hasn't helped. But I think thankfully, through education campaigns, the rate of acceptance has probably gone up. I think anecdotally speaking, more and more people are accepting from BAME communities, accepting that the vaccine is effective and safe. And there's been obviously initiatives like in the Minhaj al-Quran Centre in London, for example, through the BARTs. As you're involved, you obviously know that there's been a lot of penetration into the BAME communities, where mosques and some community centres have become hubs for the vaccine, for all communities, but particularly the BAME communities as well. So that's probably helped in terms of increasing the awareness and acceptance of the vaccinations.
Dr. Zahid, as a final message to the community, what would you like to say regarding the coronavirus? Sorry, not coronavirus, the vaccine.
The vaccine, yes, of course. I just get vaccinated. If you get the opportunity and you get told that you're eligible, as soon as you do that, get vaccinated as soon as possible, because that is the best way that you're going to stay safe from what is a very, very nasty and fatal infection in many people. And it's going to be the only way that we're going to get ourselves out of this lockdown business, which is devastating for our communities, for the economy and so on. So all I can say and reiterate is get vaccinated.
Thank you so much, Dr. Zahid. It's been a pleasure interviewing you. It's been a pleasure hosting you as well. Thank you so much. And as a message to the community, get vaccinated. And thank you. Have a great evening and have a great weekend. Thank you so much. You were listening to Revive FM 94.0.
Did you know that girls like Noura walk